Hey guys, Brenny here, practicingdentist.com, and this is part 2 of my series on hybrid startups and merging smaller practices into your hub, your existing practice. And in this video, I'd like to discuss a couple topics or a couple keys, a couple difficulties that we face when implementing these two strategies. And they involve how to do the transition correctly. You have to be really careful. Patients need to establish goodwill. You need to have a process in discussing the transition handover with the dentist who's retiring. So in any practice transition where you're acquiring a smaller practice, rolling it into a different location, existing practice, you need to, number one, be in tune to the location. So how far are patients going to have to move and drive to transition? You need something that's relatively close. So don't go looking across the city. It needs to be within the boundaries, probably a 3 to 5 mile radius of your existing practice. So important when you're starting a practice to look out and consider as part of your strategy or part of your location selection the available practices to acquire around the one you're looking at, your hub practice. And number 2 is staff. And staff is a difficult topic because a lot of times in a smaller practice acquisition, the retiring doctor probably has a great relationship with his patients, his or her patients, a great relationship with the staff. They've been around for a long time, but he's just not doing the production. He doesn't have the updates to be able to sell the practice outright. And to be honest, you shouldn't have to feel like that's your fault if you have to dismiss staff. It's just how it is. Because what happens is you're going to decide to move the practice over and you may not have room to transition to hygienists, to assistants, and to front desk. It just might not be the case. You want to make sure you stay lean and efficient when you move those patients over and integrate them to your existing system. And that's how you can really make things profitable if you do that efficiently. And unfortunately, a lot of times that means letting some staff go. When the doctor retires, the practice closes, you take the key staff that you need to transition the goodwill of those patients. That might be a front desk, if you need one, or 1 or 2 of the hygienists. Hygienists are probably the most important key because when you integrate and absorb 400, 500, 600 patients, you're probably going to need to add a new column of hygiene. So find the key hygienist, the one that knows the patients well, that can be the face that they know and remember when they're welcomed at your new practice. So staff is key. You need to make sure things are communicated well, the doctor isn't hurt, and understands the reality that some of the staff are probably going to be let go, but you want to find the key staff, the ones to take and plug into your new practice to help transition your patients. And number 3 is going to be systems. So you're going to have systems to welcome those new patients in the door. How are you going to communicate the transition? Is the doctor going to be writing a letter? I would recommend a video with the retiring doctor to do the handoff. Have him communicate prior to the transition, maybe a couple months, with his patients, and communicate with them and just state that they hand-selected you and chose you to be their successor. That they've met you and know you well, you've developed this great relationship, and they're going to be the ones kind of giving you a plug, a promotion to help the transition along. You definitely need them on your side. The patients need to see that it's kind of a cooperative agreement, that you're not just closing down the office and taking it over cold turkey. You want to be able to integrate and be part of the transition with the retiring doctors. Those 3 are just 3 of the many factors that go into a great transition and a great acquisition of a smaller practice. If you want help, shoot me an email, drbrenny@practicingdentist.com. Hopefully this helped, guys. Stay tuned. Thanks a lot.